What's going on, guys? This is Travis Price with Turning 65, where we answer your most common questions about Medicare and Medicare private insurance, along with other senior healthcare insurance questions. If this is your first time checking out one of my videos, don't forget to hit the like button and the bell notification along with the subscribe button so that you get the most recent content that I'm going to post. I do post on Sunday at 9 a.m. new content. However, there are times where I post throughout the week. So if you want to get the most fresh content, don't forget to hit the subscribe button and the bell notification. So in today's topic, we're going to talk about how to select a Medicare Supplement Plan. We're going to talk about a brief overview of how Medicare supplements work, the most popular plan differences, selecting an insurance company, and when you should consider making changes in your Medicare supplement or your Medicare supplement insurance company. Now, this is going to be a brief overview on how Medicare supplements work. If you are interested in learning more about how Medicare supplements work, check out the card up top. And let's go ahead and dig in. First, let's say you go to the doctor and you get treatment. Your doctor is going to accept Medicare. If they accept Medicare, they're going to bill Medicare directly. Medicare makes all determinations on whether treatment is covered under Medicare, if you need a prior authorization. They make all decisions. So once Medicare approves it, they'll pay the doctor their portion and then send your bill to the insurance company. Now, a lot of people get really concerned about which insurance companies to use because they're wondering, are they going to pay their claims? Well, because Medicare has already approved the claim, the insurance policy's only job is to pay their portion. They don't have a say on whether the treatment is covered. They don't do prior authorizations. Their job is to just write a check. So as long as Medicare has paid their portion, the insurance company will also pay their portion. Now, this is important for a number of reasons. One, no matter the insurance company you use, a Medicare supplement will always work this general way. While there's differences in plan letters and what it covers, and we're going to talk about that in a second, they're always going to pay their bills the exact same way. They're always going to cover the same treatment, and they're always going to cover the same doctors. So when we talk about Medicare supplements, we don't worry so much about the company. We evaluate based on different criteria. Again, we're going to talk about that in a second. So let's talk about the differences between the most common Medicare supplement plans. We're going to start on the left with F, move to G, and then N. And then after we discuss those, we'll talk about a specialty Medicare supplement called High Deductible Plan G or F. So Medicare supplements, the most common ones, all essentially work with hospitals the same way. Part A, which is hospital care and hospice and skilled nursing, they're going to essentially work the same way. You're not going to need to worry about Part A. What we're worried about is how it interacts with Part B, which is your everyday care, going to your primary care doctor if you need a walker or a wheelchair, if you get injections in a doctor's office, if you go to physical therapy. That's Part B, and that's what we're going to worry about with these three plan letters. So we're going to start with Plan F. Plan F is only available for people that were eligible for Medicare Parts A and B prior to January 1st, 2020. If it is after January 1st, 2020, when you're eligible for Medicare Part B, you do not have access to Plan F. Plan F, for quite a number of years, was considered the Cadillac plan. Essentially, you paid your premiums and everything was covered at 100%, all of your co-insurance, deductibles, etc. The big problem is that Plan F tends to be the most expensive plan on the market. and it has the largest increases every year, and it makes sense because they're paying the most out in claims. What you would do next is you would step down to G. G is considered the Cadillac plan for everybody January 1st, 2020 and after. So even to today, G is going to be your plan. If you want the quote unquote Cadillac plan, it covers the exact same things as Plan F, for the exception that you're responsible for the Part B deductible. We're in 2020 right now. It changes every year, but the Part B deductible for 2020 is $204. So after you pay $204 for your doctor's office visits, if you have physical therapy, if you have to get a cane or other durable medical equipment that's medically necessary, Medicare comes behind and pays 100%. Let's say you're on Plan G and you're like, you want to step down a little bit more. You would go to Plan N. Plan N offers all the same basic benefits of Plan G, for the exception of after you pay the Part B deductible, you'll pay up to $20 for any doctor's visit, and then up to $50 for any ER visit that does not result in an admission into the hospital. Observation falls under Part B. It needs to be inpatient hospitalization. Also, you have what's known as excess charges, which are not covered. Excess charges essentially mean that if the doctor does not accept Medicare assignment, which means they don't accept what Medicare says they're going to get paid, they can charge up to 15% over the Medicare amount. So for an example, let's say a doctor's visit is $100. Medicare is going to, but they don't accept assignment. Medicare is going to pay the 80% of $100. You're going to pay up to $20 for after your deductible for the Part B copay, and then the doctor can charge you a total of $15 more, 15% of $100 for that treatment. It's only if a doctor evaluates and treats you. So traditionally, treatment such as physical therapy or occupational therapy does not result in excess charges. It's important that if you are charged for that with an occupational physical therapist, that you talk to them and explain to them that your plan does not allow them to charge, and they would need to speak with Medicare, or you would need to appeal. The $20 would only be for doctor's visits. The 15% for excess charges means if you go to a doctor that does not accept assignment, the max that you would pay is $35 for a doctor's visit. If you go to an ER, it would be a maximum of, let's say, it would be an additional 15% of whatever the cost would be. The upside to that is 90% of providers across the nation do accept assignment. The vast majority of hospitals and doctors here in Michigan also accept assignment. So it's rare to find a doctor that doesn't these days. The reasoning why is because it's kind of a hassle to not accept assignment. They can't get direct pay from Medicare, which means they have to collect from you and then you get reimbursed from Medicare. Furthermore, there's more paperwork on their end, and just for convenience, they tend not to worry about it for an extra $15. So it does happen. You need to be aware of it. It's not common. So the next thing we're going to talk about is the high deductible G/F. Just like with F and G in the last portion, F is only available for people that were eligible for Medicare prior to January 1st, 2020. G is available for everybody after January 1st, 2020. Essentially, they're the same plan. How it works is there's a deductible Each year it changes. It's approximately $2,400. Under Plan F, you would pay your coinsurance and deductibles for Part A and B until you reached $2,400 of out-of-pocket cost. Once you reach $2,400 or so, give or take, the high deductible plan would come in and pick up 100%. Medicare is going to still pay its portion. It's the insurance company that doesn't pay until you reach that $2,400. On G, the only difference is if for some reason you've amassed $2,400 in out-of-pocket costs but have paid nothing in Part B, which is really, really exceedingly rare. It's almost impossible. You would need to pay the Part B deductible. After the Part B deductible, the high deductible plan G would pay 100%. So max, you're looking at approximately $2,600 to $2,700 out of pocket under high deductible plan G. Now you might be wondering why somebody would choose that. It gives you the freedom of being able to choose any provider that accepts Medicare, but it also, because the insurance company is not paying so much, the premiums are really low. And the cost savings that you're paying, you're only paying 20% for Part B services after your deductible, or the Part A deductible if you go inpatient. So it has a cap where Medicare overall, original Medicare, doesn't. It's a great alternative to Medicare Advantage if you are wanting the freedom to travel around the country and go to any doctor you want to go to, but you don't want to pay so much out of pocket and you're willing to pay for it when you use it. So it's a great alternative. It's something to consider if you want to keep your costs low and are willing to take on some of the risk associated with health bills. But that's the big crux of it. So you're wondering to yourself, okay, I know about how Medicare works. I know how the Medicare plans work. I've chosen a plan, because you always want to choose in this order. You want to choose Medicare versus Medicare Advantage. Once you've chosen those two, you want to decide what plan is best for you, F, G, N, or high deductible plan G or F. And then you want to pick the company, and here's why. Every company has niche underwriting that they approve more likely or have lower costs than other companies. And that's even at the zip code or county level. So here in Michigan, let's say you're up north in Traverse City. Well, there's one company that's super competitive that has really great rates and offers you everything you need in regards to the plan letter. But if you head to Detroit, there's another company that I would suggest, because it overtakes the company here in Traverse City on its cost. So monthly cost is one of the most important things we're trying, because all Medicare supplements, the plan letters, regardless of the company, all are going to work the same. They're going to cover the same doctors, they're going to pay the bills the same, and they're going to cover the same services. Next, we're going to worry about financial strength. So we want to work with somebody that's at least A- rated. That means that they are going to be financially stable and be able to pay their claims when they come out. How long they've been in the state, that is equally as important as the monthly cost. And the reasoning why is the longer that a company has been in the state, the more experience that they've had in claims, which means that they know generally what to expect in a year and can charge you accordingly. When you have a company or a subsidiary of a company that comes in like for 1 year, they don't know what the claims experience is going to be. So they start really low to get people in the company, get their claims experience, and then the rates start to jack up. So usually you want to have them at least at least 5 years before you consider them. After 5 years, they are considered somewhat stable. They've either left the state or their rates have stabilized because of the claims experience. Prior to that, they're kind of all over the place. So we want to watch companies or subsidiaries that have been in the state for less than 5 years. That's actually more important than monthly cost, because monthly cost will be directly influenced by that. And finally, where you want to worry about US-based customer service, and that's really about when you have to call the insurance company, can you understand them, or do they have really great customer service? Because you're going to interact with them at some point. We want to make sure that you enjoy interacting with them, because if you don't, then you're never going to be able to make any changes. So when should you make changes or consider making changes in your Medicare Supplement Plan letter or your Medicare Supplement company? We're really going to focus on the company, though. The first is if you get a 1-year increase of over $20. Usually Medicare supplement companies group together. There are a few that are really expensive and then a few that are really cheap, and then you have the majority that are kind of in the middle. So even though you may have company A and they've jacked up their rates $20 or more in a year, there may have been a company that is equally as impressive as the one you had, but they're still at the lower end. That doesn't mean you have to make a change. It just means something to consider. Secondly, if you've had bad experiences with their customer service, you shouldn't be with a company. If you have bad experiences interacting with them, that means that they're not helping you. They're only providing the plan, and everybody provides plans. The customer service is part of the reason why you choose the company. And finally, every 5 years, you should consider shopping around. Again, this doesn't mean that you make any changes. You may be with the best company, but you want to make sure that things haven't changed in the state or plan rate increases haven't skyrocketed without you not knowing about it, because they've only changed maybe $15 a year, but for the last 5 years, they've changed $15. So there might be $75 out of whack. You just don't know. And so it's always important just to check things out. It doesn't hurt you. The right insurance agent is going to keep an eye on this anyway. And if you've worked with somebody really good from the beginning, then when you call them, they're going to tell you straight up, just stay where you're at. It's better off. If you have additional questions, please don't hesitate to leave them in the comments. I do watch comment questions and answer them. If you want to learn more about Medicare or Medicare private insurance, check out travisprice.com/turning65. We have videos, articles, and other content that you can check out. They answer a lot of the most common questions. You can also give me a call at 231-884-8161. I am a licensed insurance agent in the state of Michigan, so I am able to help and discuss insurance and insurance quotes with you. Thank you so much for checking out this video. Don't forget to hit the subscribe and the bell notification so you're alerted when I post new content, and have a great day.